Hello, another day to try again. What's going on, everybody? This is Frenchie, outrageously thinking.
Yo, that's outrageous over there. It's your boy JP. Simple. Let's get it. Let's get into today's episode right here on the Simple Outrageous Podcast Show. All right, everybody. Thank y'all once again for tuning in to another edition of Simply Outrageous. This your boy JP right here. I got a special guest. Y'all know her. She came on here before. The one and only Miss LaLa. How you doing, Mel?
I'm doing good. Hey, everybody.
How you doing? How was your week so far? How was your weekend? How everything for you?
My week was good. I worked the past weekend, which was okay. I mean, I've gotten immune to working on the weekends, but it wasn't bad. I can't complain. I can't say anything negative me working, but I had a pretty decent week. Things been a little slow, but you clock in, clock out, and outside of work, just managing stuff, getting everything together that I need to do.
I know how that is. Definitely know how that is. I think that's everybody's mentality right now. Is just like do something, get out, do your hours, and go. You can talk along the way. If not, then you just go. Whatever. Your main thing right now, get money and
Still enjoy
try
life.
to
You gotta
yeah,
go a little bit.
of course, and enjoy life on it. Yes, that's the
Yeah.
main thing.
Can't be a
But
slave to reality all the time.
of course, you have to. But we do got a couple of questions. I do have a couple of questions for you. I want to get your input on these stuff. Are you ready, Mal?
Yeah. Let's
Yeah. All right. Um, what are some of the challenges you faced when you first started working in your field? If if anybody is new to this, Miss L right here, she is a pharmacy tech. She's gonna explain to you a little bit, and then she's gonna get into that question. Go ahead, L.
um being strategic was like one thing that I faced because I came from working in customer service as a pharmacy technician, and prior to that I had customer service jobs. So, answering the phone, answering questions, and just being like looking at a computer screen all day. So it was a challenge for me because I had never actually physically packed meds, but just being strategic because everything's on a time frame. So I'm not sure if anybody knows, pharmacy technician in a long-term care pharmacy, everything has a time frame on it. Um, it goes out at a certain time. It needs to get to the facility at a certain time, especially when patients needs refills. So they probably took their last pill last night or this morning. So just being strategic and learning to have a social battery with people. Like, um, I'm a very social person, but I sometimes don't want to socialize with people. So even though it's a closed door pharmacy, you are still dealing with your coworkers. You're still dealing with this person, that person, or management and or new hires. So I'm a trainer at the pharmacy that I work at right now. So a lot of times when we get new hires, train them. So it's a lot of repetition in it, me repeating myself or me still trying to help and train at the same time. So those are challenges. Like I just had to learn ways of how to move faster. Once you figure out where everything is, I'll say give you a good 30 days and you kind of figure out where everything is. So when you're looking for something, you know exactly what it is, where it is. So when I first started, it was a big challenge for me because I never worked in a pharmacy that large. I never worked where I had to go down the aisle and find this. So yeah, it was a big challenge. Like you have to stay focused and figure out what it is that you're trying to, whatever goal you're trying to reach. So we have a numbers game. And the numbers is not like a big deal, like, oh my God, you gotta do 200 meds a day. It's not like that. But when you do get a stack of labels or something like that, and this goes out in 2 hours, you want to learn how to be strategic with it. You want to learn how to find a way to be faster with it. So those are things that I did challenge. It was a challenge for me, but of course now I've been working at that pharmacy for 3 years starting next month. Everything is the norm now. Like I know where this is. I know where that is. Like, it's very rare if I don't know where something is. Like, I know where everything is. But that just comes with time. I always tell people that anything you do, it comes with time. They always say practice makes perfect. It never makes you perfect, but it makes you aware of anything. Like something that you're doing repeatedly every day. It's you can do it. Anything, any field, not just my field, any field, anything that you're doing every single day becomes immune to you. Like you know exactly what it is. You know exactly where it at. You know how fast to move with it. So before it was a challenge, but now it's like a piece of cake. Not to toot my horn, but it's a piece of cake.
Mhm. Okay, I can respect that, and I definitely can understand your point of view. But let me ask you a question. For you, when you first got into the pharmacy, and you said by the size of the pharmacy itself, do you think you would adapt to it quicker if it was a smaller, like a retail pharmacy, like a mom and pop pharmacy versus a wide range of a pharmacy?
If it was a mom and pops, I would have definitely adapted faster because it's smaller, of course. So with long term care, you are dispensing everything from body wash, face wash, lotions, topicals, um, they even have fax toners, which are for printers, like because you're servicing facilities that have a large amount of elderly people or sick people in those living assisted facilities. So it's a lot of things that you see and you're like, oh my God, we dispense this. I thought this just was about medicine. It's not just about medicine. They might be getting gauze, band-aids, alcohol wipes, they get everything because remember, those people are there for a long term. That's why it's a long term care pharmacy. So, definitely, if I was in a mom and pop's pharmacy, I would have definitely picked up fast. I'm a fast learner, regardless. Anything, like I said, anything that is taught, and it's not just for me, like I always tell people this, like I know that I'm a little, overly smart, but I feel like anything that you are taught and you pay attention to it, you will be able to pick up on it. So for me, even if I stepped out of this field, wherever I went, I would still be able to be the same way that I am in this field because I pay attention and I catch on to things. So if it was a small pharmacy, yes, I would have probably caught on quicker. And I am still learning a lot of stuff. It's not, I don't know everything about pharmacy, so I am still learning, but anything that you do repeatedly, it becomes a norm to you. Like it's not new to you. You're going to come in and you're going to do the same thing every day. There's nothing really different unless they say, hey, we got a new facility and we're packing this a specific way. That is like the only thing. But again, you do that for a few weeks, it's the norm to you.
Yeah, that is true. I think one of the main things for me when I first got into the pharmacy field, it wasn't about knowing a lot of stuff. It was actually like remembering my drugs or how certain things was how they taught me how it's going to be.
Right.
But that was pretty much my biggest thing, challenge, just to remember this a drug. I mean, now to the point I can give you the 300 drugs right off the top of my head without no problem. But I think that's with a lot of the new people that are coming into the medical field. I think the adapting to the environment, that's probably one of the biggest challenges that they're gonna have. And a lot of stuff, people they don't see these stuff on a daily basis of what we go through from, but like you deal with a closed doors, so which is good versus a person that working in retail, they deal with people, they deal with
Mhm.
the seniors, the managers and every they deal with that too, but with I think the biggest outcome is mostly dealing with the seniors that coming and the impatience of people. You know, nowadays everybody is not patient, so that's one of the I think the biggest challenge for a lot of the new people. But I think overall, I think the biggest challenge for me, and I can piggyback off of what you said, but mine will mostly would be the remembering of the drugs. This is this. What is this for? What is this for? An ACE, all that stuff, the beta blocker and all that. But I can definitely understand your point of view.
And even with what you're saying, like I said previously, there's a lot of things I don't know. So like I was talking to Stu, you know Stu. and
Mm-hmm.
we were talking about the benzo capsule, the gel capsule. And one of my friends, she had got really sick recently, and they had gave her that for a cough because she had a really bad cough. And I, before she got sick, me and him was talking about it because I gave him the bingo card with 30 of them packed. And he looked at the prescription and he goes, they already had this for 30 days before. He said they shouldn't be taking this again. This is a drug that you only supposed to take for 30 days. If they're prescribing it to you again, then they're not fixing your problem. That's not a drug you
Mm-hmm.
take twice. So it is a lot of stuff that I don't know. About drugs. I didn't go to school to be a pharmacy technician. I didn't go to school to be a pharmacist. I didn't go to school to study medicine. I didn't go to school when it came to big pharma. That's not my specialty. So I'm still learning. It's a lot of things I
Mm-hmm.
don't know. It's drugs that I pack, and I can't tell you what they're used for because I'm just packing them. So it becomes very robotic, where you're just packing them. It says they want 30, you give them 30. It says they want a pill and a half, you cut a half a pill, you get them a whole pill, how many ever it is. I don't know. So it is still a challenge too, because I don't know what these drugs are used for. I know what over the counter is used for. I don't know what everything else is used for. I'm just packing them. So it's a challenge because it makes you think like, okay, what am I doing? Am I like just packing these meds? I don't know. Like the heparin injection, you're not supposed to get more than 15 of them. You're not. Like it's either you get 10 or you get 15. And if you're getting 15 more than 15, then the pharmacist needs to review it again and be like, okay, why are you getting more than this? There's a lot of stuff that I don't know. But again, when you're taught something, it like I said, it's robotic. The label comes out. It tells me how much you need. I give you how much you need. I'm not even looking at the directions to see what it's for. You know what I'm saying? Like I'm not, because that's not my job. I'm not a pharmacist. So I feel like that's the last thing I should be thinking about. The pharmacist reviewed this. It's okay. I'm packing it and I'm sending it off. But I do want to do better with stuff like that. Like I want to make sure that I'm learning if quotations if I want to be in this field longer, I want to start learning what these things are used for. And I want to learn why are you taking so much of this? Because it makes me feel like when I get older, I don't want to be taking all these drugs. You think I want to be taking all these drugs? I want to be taking this. And we're not paying attention to the patient's name. But me and I'm going to say Sarah, we're packing medication for the same person, and then Johnny's packing the medication for the same person, but they're all different meds and they're taking them on a daily basis. And it made me sit and wonder, like, why are you taking so many drugs? I'm talking about you're taking 3 to 4 different drugs in one day. So like it opened up my eyes, and now it's challenging me. It ain't really challenged me that much before because I'm just doing whatever you told me to do. But now I'm sitting there and I'm thinking like, why are you taking so much stuff? Like, and it kind of made me don't want to be in the field because I just feel like they're just giving them drugs, giving them drugs, giving them, and I don't want to be that way. I don't want to be that way when I get older. I don't.
Yeah, no, I definitely understand your point, but something like that, you you want to be able to know what you packing. So
Right.
I really hope that you do learn a lot of them stuff that you, even though let's just say you're not going to be in the field within the next 3 to 4 years, whatever. But if you outside and somebody taking no pills, you can, hey,
Articulate.
this
Yeah.
is for this, right?
Right.
You know what I'm saying?
Like,
Like you said, you gave the heparin. A lot of people, yes, heparin is not supposed to be used for that. It's a high cost drug. You know what I'm saying? And that's right there. That's just a blood thinner. You don't want to thin out your blood more than what you're supposed to,
exactly.
and that still can end up causing a death. But it's not even the pharmacists. They supposed to be reviewing that before they get it, but also they should be questioning the doctors. The doctors, how many doctors don't even pay attention to what they write? They just
Because they
write.
didn't
I see it
study.
on a daily.
They're not studying medicine how a pharmacist has to study
No.
medicine. You remember the
Of course.
lady
Hmm.
that used to come on the weekends and she ended up passing her board test or whatever. And
Hmm.
speaking of heparin, I forgot her name with the long hair, the older lady. And she only came on the weekends. She didn't come on the weekdays. She had said something to me about heparin and she was like, I don't know why they're taking this because I think heparin goes with warfarin. if I'm not.
Mm-hmm. It
So
does.
she was just like, why are they taking this? And like, and she was giving, you know, she was educating me. Like, I'm a pharmacist. Like, I'm about to be a pharmacist and I've studied medicine and they shouldn't be taking this with this and this because it's drug interactions. Like, you're not, so I appreciate the field that I'm in because as I get older, then I'll be able to remember this. Like, okay, I shouldn't be taking this with this. And even when I worked at Walgreens, I was in the MTN program, which we reached out to elderly, more so elderly people, and we will ask them, hey, are you still taking this? Are you still taking that? And we was well not print it, but we would mail them their updated list of medications. So when they go to a new doctor, their doctor can understand what they're taking. So they're not prescribing them something that has a bad interaction with this drug. So, sometimes I do feel good about what I do because, yeah, I don't want people to be dying over big pharma. I don't mind over a company that's just making money off
Mhm.
of just giving you whatever. The doctor say you need this, your insurance pays for it, here it goes. Like. So sometimes I do try to take a step back and like look at stuff like that. Like, this is really bad. Like this is not how I want to be when I get older. I want to be like healthy and I'd rather just be doing more natural things than, if I needed antibiotic, come on, that's stuff that you need. Like there's things that can't fight certain things. So that's understandable. But other stuff is like, do I really need it? Do I really?
Yeah, no, I definitely understand you. To everybody that's listening, man, health is your number one priority. That's your biggest thing nowadays. We deal with so many stuff, so please take care of yourself. Please take
Edu-
care of yourself.
Educate yourself first. And remember,
Yes.
before BC, before century, they medicine. They didn't have medication, and I'm not going against the big pharma. I'm not going against them. I just feel like, do you have to? It's a question. Like, do I have to take all of this? Do I have to really take all this? Because remember, when you're taking a bunch of medications, it overflows your liver and it makes your liver bad. So if I'm taking all this medication and it's making my liver bad, now I run into another problem. So that's what I want everybody to like open their eyes to. So right now it is very challenging for me. In the beginning, it wasn't because I was just working. I'm just working. I'm packing pills. And as time grew, I started being challenged to things like, should I be taking? That's just something I think about, and um, it just makes me realize, like, as I get older, I want to make sure I'm healthier, so I don't have to be in that position.
I got you. Gotcha. And so one of the next questions that I had got was, what gave you the motivation to keep going during the hard times within pharmacy?
Um, I hate the sound. I can't even think of the word. I can't. I hate the sound statistically, like people, the norm, money. I'm not thinking about, oh my God, I don't want to be here. I don't like this job. Everything is, which is bad. Everything is money. Right now in the world today, everything is money. So whether I was working at the job that I'm working at in pharmacy or whether I was working at McDonald's, money is important. So that's what keeps me going. Like I'm gonna clock in and I'm gonna clock out. That's what keeps me going. I'm not really solely on, oh my God, I don't like this. They're not doing this with the patients right because I'm in closed door. So I don't know what's going on with these patients. I don't know if the patient that I filled yesterday died tomorrow. So my goal is just always to make sure I'm doing my job to make sure that I'm taking care of me. So that's what keeps me going in my field. Now, if I was in like a law field or I was like in a hospital and I have to save a life, then of course, then I have something else to, say this is what I'm here for. I'm here to save lives. But in the field that I'm in and I'm packing meds, we just pack meds and we keep going. We don't know if the patient we packed the med for today died tomorrow. We don't know that. So we're never focused on that. We're focused on money. We're focused on getting through the day. So life itself is what keeps me going. That's where I'm going. I'm going with life. Like I'm going with time. So, um, but I know in other fields people do have a more focused on other things like saving lives and stuff like that. Or I'm a doctor or pediatric. I want to make sure the child is this. So in my field, it's kind of hard to say we don't focus on things like that. We're only focused on making sure that we gave them the right amount of pills, make sure we gave them the right pill, and that's it. We're not thinking about the patient. We don't know your name. We don't know anything. We're just packing whatever your doctor sent, whatever your insurance.
Definitely, you do know the name because you see the name on their label. You see what drug you taking, so
But I'm
you
not
know their name.
for them.
No, of course not. But
I'm not gonna
you,
remember too.
you, hey, I pat James Doe. I'm gonna remember I pat James Doe yesterday. You know what I'm saying? In the sense like that. You
Sometimes,
know, some people maybe.
sometimes it
But the
depends.
thing,
It depends on if it what type of day it is. If it's a crazy day, I'm not. If it's
well,
one of
again, it says during a hard time. So during a hard time, it can be anything. You know what I'm saying? I like for me personally, I think during a hard time that keep me motivated is I think making sure that that person be able to stay alive. That's my main motivation. You see what I'm saying? So as long as that person is still alive and I'm able to still constantly feel, I don't care if that patient getting four tablets, four
but
capsules,
but
seven or whatever.
not to interrupt you, but is that what you're really thinking about?
In a sense, in some cases,
No,
it's
because
just like
yeah, I want you to be 100% honest, right? Because
I mean, and
I'm gonna always be 100% honest.
no, of course,
Johnny, when I'm packing that medication, I'm not thinking about it. And it is bad, but I'm gonna. I know, no, seriously, it's not like I work in IV. You know what I'm saying? Like
of course.
I work in IV. Okay, I'm going inside the room and I have to glove up and guard up and put on my hairnet or whatever. That's different. But for us that are packing pills, they're not thinking about. I mean, the only thing I can tell you that I'm gonna make sure of is that I'm packing you the right drug.
That's the main thing. So
Always,
that's
I'm
let's
always
go back to making sure that person is alive. So if you pack the wrong drug and that
you.
person have an allergic reaction to that drug, you are in trouble.
Yeah.
So again, that go back to me what I'm saying, making sure that person stay alive. That's one of the biggest concerns. That well, for me, a little bit, you know what I'm saying. But I think
Of course.
majority of my time and being in pharmacy, I think my biggest concern was making sure that I feel comfortable within my pharmacy field and my expertise, knowing the pharmacy. That's it, really. Other than that, I didn't really even care at that point. You know, I didn't care about the money at first because eventually it would have come. Eventually it would have come to you.
So let me ask you, right? How did you get in pharmacy? What made you want to go into pharmacy?
What made me go into pharmacy is what pretty much was
Don't lie.
coming back.
Don't lie now.
No, no, no. I'm telling you, like I said, me seeing my granddad with all the meds, my grandma all the meds, even hell, even my mom taking meds for certain things. And me figuring out, okay, what is this green pill for, or what is this white pill? Why is this pill bigger than this pill? That's one of the main reasons. Like, what are they taking? That was my biggest concern and my biggest reason for getting into it. It wasn't about the money at first. At first, no, because again, it came to me that okay, eventually, if I know my stuff and I can do what I gotta do, it's gonna come. I'm gonna get a raise, a $2 raise here, maybe a $3 raise here, or something. It was the biggest concern. What are you intaking? What are you taking? That was my biggest concern. And how can I help my parents at that time, or my grandma, or even my friends though, because they were taking meds. A lot of them were taking meds. Like my cousin, he on aspirin. He not aspirin, but he was taking pretty much like all the what's that aspirin, like all those. So you know what I'm saying? So he had all the different problems, the inhaler problems. He had all that. He was taking steroids at a young age. So
Right.
why are you taking this? What
So you just wanted
is
to
some
know the reasoning behind it, as if you probably should have been a doctor or a pharmacist, because we don't learn that. like, not to say what you're saying is not valid, but we're our job is not to know exactly. And let me tell you something. If if the pharmacy technician field was solely based on technicians knowing, it wouldn't be so easy to get in because learn that. That's what I want people to understand. And I at first I felt a way about not knowing stuff, and then I thought about it. I'm like, no. When I worked at Walgreens, there was a time where we can explain to them why this was being used, right? Because if an elderly person call, they don't know. Like my grandpa, for an example, he doesn't know exactly why this pill is. The doctor just right. So let's say he called me. I'm working at Walgreens, and he's like, "Oh, I need Eliquis. Can you tell me what the Eliquis is used for again?" They don't know because their doctor is just giving it to them, or they just forgot because that's not their field. I'm just the patient. I'm not here to know exactly why. You told me to take it in the world today. Whatever you tell me to take, you my doctor, I take it. So I used to feel some type of way when I started packing meds because I left Walgreens where we were able to see what it's used for. And then I got to a point where we not worried about what it's used for. You just need to pack this medication. If I give you this label, you pack it. Now on the label, if you're curious, you can read it, and it may say blood thinner. It may say for lupus, like my friend that has lupus, she has cephalexin. And I was like, I pack this drug all the time. She kept saying, "Oh, LaLa, I have this big purple and blue pill, and I don't like taking it because it's so big." So I said, "What's the name of the pill?" She said, "Cephalexin." So I said, I said, "I pack that pill every day. It's a fast mover. It goes every day. Somebody's taking that every day." And I looked at a label one day and it broke down to me different reasons. Because, it'll say on the label like, oh, it can be for, I think, HSV. No, icyclovir, the cyclovirs. Icyclovir, cephalexin. It's a lot of different meds that are used for the same thing. And then I start educating her like, oh, this is used for this. And this is used because when you're taking a bunch of pills, you're going to lose the train of thought of what it is actually for. You just know the doctor said take this for 30 days. And then you got another pill, take for 10 days, take this for 60 days. So I started like kind of being mad at myself because I'm like, I'm not even educated on why are they taking this, but I'm not a doctor and I'm not a pharmacist. So I don't have a say so. Only thing that I have to do is pack the meds. So for you, I definitely, because you were curious as to why you're taking these meds. For me and other people, especially people that's coming from call centers or CVS, we received our certification those places, and you only had to pass with like a C average of 70%, and that was it. They may ask you what's the generic or the brand of this, but they're not asking you what it's used for. So you're not educating yourself on what it's used for. You just like, okay, how many days can you take this for? Okay, they only can take this for 10 days. They only can take heparin for 10 to 15 days. Like it's a memory. It's not an education. It's just a memory. I just remember this. It's not, I've been to school and I studied this. So it's different for some people because people come in the field and you said pack 30. You said need a foil, I'm gonna give it a foil. You said need a high alert, I'm gonna need a high alert. You say it's a hazardous drug, and go to hazardous sticker. So you're immune to that. You don't know. You don't know. You're not a doctor. You're not working in a hospital. You're just packing it, sending it out. So a lot of people don't go through what you experience with people taking drugs and you're curious. I didn't go through that. I've never
Right.
been around people that's taking over the counter. If you're taking aspirin, you got a headache. You're taking an Advil, you probably got a stomach ache. Things like that. But real serious drugs, no. I'm not educated on it.
See, now I say for me it was different. I was I'm a damn Scorpio. So we curious to what we want to be curious to. If we're not, we don't give a damn about. You see what I'm saying? So, like I said, for me, I was curious about them certain stuff, and also just seeing it on a constant basis every day. So it's like, okay, I need to know what this is for. What is this is for? What is this for? I used to be able to tell you the imprint on the pills. So like
Right.
dude, I can tell you that. But and
Yeah,
again,
me
that go
too.
back to my teacher. That go back to my teacher when I went to school and we had to study all this pharmacology and all this other shit that we had to go through. So it was like, damn. You see, I wasn't grandfather in like how CVS or Walgreens, they
Right.
take you under the belt and stuff.
Become
It was
easier.
different.
It's become
Hmm.
easier because, like I said, it's robotic. I tell you what to do, you do it. I tell you what to do, and you do it. There's no why. There's no why in pharmacy no more. In technician, the pharmacy
Right.
technician field. Now it gets to a pharmacist that is like Miss Sharon or Stu. They'll say, "Hey, I'm not sending this because X, Y, Z." Me, I'm curious, so I ask, "Okay, so why are you not sending this?" And then it gets broken down to me. But coming in, and you may run into a pharmacist that say, "Hey, I'm sending out. That's it's gone. It's going to the driver." Like everybody isn't educated, and I think that's kind of why pharmacy technician is not at a like it's not set at a high standard how it probably should be. Because if I tell you to pack it this way, that's what you do. It's not about you wondering anymore. It's not about if I say this is okay, you pack it because it's a money thing now. It's just money. Like we want to get
Hmm.
their stuff out. They pay for it. Simple. Very simple. They pay
Yep.
for it, send it. We don't care if they taking this much every month. Send it. That's it. That's what pharmacy technicians do. We're robotics. You sending it. You it's nothing to think about no more. Send it.
Yeah. And I think that bring us into like one of the next questions that I also had got. Like, do you have one piece of advice for someone starting in your career in pharmacy tech?
You figure out what are you doing it for. So me, it's not something I care to do. I never woke up one day and say, "Hey, I want to be a pharmacy technician. I want to pack drugs, and you know, I want to make sure they're getting the right drug." Because you can't argue with a pharmacist, right? So if I go to an
Shoot,
old
I
school
can.
pharmacist and they say, "Why did you do this? This is yeah, like why did you do this way? Why did you do this that way? Why are like we don't have a say so because we're just a worker. So, what are you in this field for? Are you in this field because you want to grow from it? Maybe you're in pharmacy school, maybe you're in nursing school, maybe you're just here to make money. You just have to figure out it. I spoke with a student, his name is Ryan. I think he's 20, he's not even 21 yet. He's a student, and he was asking me, like, how much you get paid and how much this and this and that. And I was like, well, I can't tell you how much I get paid, but if you're coming into this field, you need to figure out what is it in this field that you want. I said, what got you to even come here to do hours in for school? What is it? And he's like, oh, it was an ad, and I was in school and it was something that was there. A lot of people just go into it because they hear pharmacy. Oh, that's gonna be good. That's a career job. Like, no, you go into things that are exciting for you. You nurses. People always tell me, "Oh, you should have been a nurse." I started at Miami-Dade College after high school. I had a scholarship, and when I got into nursing, not into nursing, but as I started my credits and I started researching it, it was like, "Oh, it's going to be a lot of math." I hate math. I can count money, but I don't like math. I don't like algebra and all that. Like, so I opted out of it because I don't want, this is not me. It's people that love math. They love equations. They love to figure out things. So it's for them. You have to figure out what it is that you want to do. Or if you say, "Oh, I'm gonna just come to this pharmacy and I'm gonna learn everything in this pharmacy so I could take it elsewhere. I could leave here and I could go here with this information." Like, and that's one of my biggest challenges right now because where am I going? Where am I going? I know how to work the machine. I know how to work one of the machines. I understand if I worked in the control room, which is just narcotics and, C2s and things like that. That's normal. You can teach a fifth grader that and they're going to do it. You get what I'm saying? So it's about what you want. What is it that you want? What is it that makes you excited? I'm not excited anymore. But if this is exciting for you, then hey, so be it. But at some point, whatever you're doing, it has to be something you want to do. Like it has to be. It can't just be because somebody told you that, oh, this is a good field. Oh, go be a nurse. You think I want to be a nurse to 60 years old? I don't want to be a nurse. I don't want to see people die. I don't want to be sad that my patients are going through stuff medically. Like I'm not built for it. So you figure out what it is that you want when you come into a field or what you're going to take out of it and keep going. A pharmacist told me today one of his friends was a pharmacist and then he ended up going into doctor. Like now he's a specialist, a skin specialist, dermatologist or whatever. And I was like, "Oh, he's smart and he got money." And he was like, "Oh, you just worried about money." I'm like, "Yeah, but he went from being a pharmacist from all those years you had to go to school to going and transitioning to a doctor because guess what? Probably him being a doctor was more exciting than me just packing meds. Now I get to decide what you are going to take. I get to decide what's best for you, not just packing it or not just letting it go because your insurance paid for it or you paid out of pocket. So always figure out what it is that you like to do. Don't ever get stuck into something just because you think that's what you're supposed to be doing or because somebody gave you advice about it. No, do what you like.
That's true. I definitely applaud you on that one. That is true. I think for me personally, what I tell people, because me being in a manager role, is learn. That's basically what I'm gonna tell you to like learn, adapt to changes. Don't be selfish. How a lot of the new generation is to into this stuff. You got to learn to be able to gain the knowledge of whatever you're trying to, whatever field you're going into. It doesn't matter if you want to be a business person or
You got to
a
grow.
doctor or something. You got to be able to grow and you be able to expand. Think outside of the box. You have to critical thinking on everything. But the main
Sometimes
thing,
you
you
gotta
just learn. Yeah.
look.
Find you a mentor. You know what I'm saying? That's
You
one of the
gotta
biggest
cheat.
things.
You gotta cheat
hmm
life sometimes.
Yeah, of course. Yeah, yeah, of course you have to, but
You gotta cheat.
find that mentor though. That's your biggest thing. Find that mentor of what are you trying to accomplish? What are you
Right.
going, like you said, where are you heading within the next couple of years
And
of your life?
some people just do it for money because again, it makes life easier, right? So if I can go back, right, I probably, if I knew that I was gonna go in the pharmacy field,
hmm
I would have went to be a pharmacist.
Really?
I
You?
would have went to be a pharmacist because I know how to pack the drug, right? I can learn what the drug is used for, right?
hmm
Know that I can articulate that you're not supposed to be taking this drug. So if you're a pharmacy technician and if a pharmacist keep telling you the same thing every few weeks, like, hey, they're not supposed to be taking this for this amount of days, or they're not. Like I've educated my friend on that when she was taking the benzoate, and I said, hey, don't take that after 30 days because a pharmacist told me if you still have this bad cough, then the medication isn't working. So why give me a refill? You know what I'm saying? So if I can articulate that from a pharmacist, I could have just been a pharmacist. You know what I'm saying? So I mean, life is a you can't cheat experience. So I'm experiencing things that if I could go back, probably would have been a pharmacist. Like my mom went to pharmacy school at Nova, and after like her first year, she was just like, mm-mm. Because to be a pharmacist, it does take time and it takes patience. You can't. It's not something that just happens overnight. And she realized like this is in the field for me because this is going to take a lot of studying because remember I'm given the okay for this drug to go. So but if I can go back, Johnny, I would have been a pharmacist. I definitely would have been a pharmacist. I wouldn't mind looking at a medication and PB1 in it and making sure that they're giving them the right amount of drugs a day. I would have went if I can go back, I would be a pharmacist. I would not mind being a pharmacist. Like, if I'm that close to understanding, I could have been a pharmacist. Why?
Okay. Okay. I mean, hey. I mean, it probably still time.
Nah,
We young. We are young. Come on now.
I
We
ain't
are
gonna
young.
on that. Mm,
We are
no,
young. We can do that still now.
I'll be just like Stu. And because time changed and it's a new era, And everything is, again, I have to keep talking about money because our world is solely based on money, currency, right? He always tell me this, like these new pharmacists, these new doctors, these new nurses, everything is money, money, money. I don't care about your health. I care about your money. I care about this money given to me. I care about the money you're giving to this company, and at some point is dispensed to me in a certain way. So right now today, ugh, it sucks. But back then, pharmacy was cool because they're doing the right thing. But right now, everything is not done right. So that's why pharmacists like Miss Sharon, pharmacists like Stu, they're the ones that are not going to let things go. I had to do a week ago, I'm going to say almost 2 weeks ago, I had to do a pantoprazole 40. It was a 20 milligram or a 40, can't remember. But you know, those are don't crush. So you're not even ever supposed to crush them up, right? I had to do a 280 milliliter with 70. No, it was four something. It was 475 or 473, something like that. But I had to crush up 70 pantoprazole milligram pills. They don't crush. The coating of them do not dissolve, Johnny. You know this. I crushed up all them pills. I had to use a silent night to crush them pills. When I gave it to Miss Sharon, she said, "This is not going." She said, "We don't crush this. It's never going to dissolve." She said, "I'm going to put it in the refrigerator and I'm going to call the doctor's office or the doctor that prescribed this to the patient because this is not going. It's not going." But guess who prescribed it? A doctor. A doctor prescribed it. When this drug is a do not crush because the coating on it does not dissolve. My love, it doesn't dissolve. And guess what? I'm not going to say the pharmacist's name. Another pharmacist let it go the next day. When I came to work the next day, that same script came back out. And I said, "That's the drug that I made the other day as a compound. It's in the refrigerator." This pharmacist said that they don't want it to go and they need to change it or they need to put it in a powder form or X, Y, and Z. And that pharmacist let it go. But guess what? The pharmacist from the beginning, from an old school pharmacist, called the doctor's office and said, "Listen, that is not what they should be taking. They had to destroy it." Because this old school pharmacist knows for a fact that this is no good. Who prescribed this? Why you prescribed it? You know what I'm saying? Like, so before pharmacy was cool, but now it's money. It's money. Everything. And if you're a caring, love person, and you care about people and you care about their health, that's what you're gonna think about.
Of course. Yeah, that's true. But I think at the same time, would you think money would get the best of you if you became a pharmacist?
No, not if I went to school for that many years and my license is on the line. No, no, never, never. That's just not me. I love money. I don't love money, but I enjoy making money. But
Right, sure.
to know that my job is in somebody's life is in my hand because based on my job and what I went to school for, no. I will be just like that old school pharmacist and say no to it. No, this is not good. This is no good for them. Like, come on. Like you you can't be in a field that you say you care about people and then but you still care more about money or about your job or what your boss says. Your boss says it needs to go. They ordered it. It has to go. No. You didn't go to school for that many years to listen to somebody else that probably didn't go to school or not as educated as you to just let it go because they want to make the company happy or they want to make the company look good because we sent it. No.
Yeah, no. Um, Definitely with that drug right there alone, I never dispense that drug. I never,
Troprazole
never.
and Trop. Do
Yeah.
you know how long it took me to crush 70 of them? I had
Uh,
to do 5 or 6 at a time. At a
yeah.
time. Just for them to, just for the powder in the inside to crush, like to soften up. But the out coating of it is still hard. So when you mix it in a bottle, you see the coating floating around like plastic.
Mhm.
If you ask me, it looked like plastic. So you're drinking plastic at this point. But yeah, that that's just how I feel. Like if I had to make a choice, um, it's a lot of things that I wouldn't accept, and I think that's why I rather be kind of more behind the scenes than being on top. Because if I was on top, I'll be a problem. If I
Hmm.
was lead or if I was a supervisor or I would be a problem because I would always debate everything. Everything would be a debate with me.
Well, that's what I do.
Everything would be a debate.
That's what I do. Yeah, I definitely can understand that. But for next question, what did you wish you knew before you started as a pharmacy tech?
Um, that there's not a lot of growth in that field. I had seen a Washington Post. One of my other coworkers, the guy, you know him. I don't know if I told you, the one that worked in the control room. You know him, but we're not going to say names.
Yeah, know him.
You're cool with him.
That's my
So
buddy.
yeah. So we spoke about because me and him been talking like a year ago about getting out of the field or getting into another medical field, like and he sent me a Washington DC um article post because they have like Washington DC, they have a lot of successful black people. So he sent me a post and he was like, it said top 10 worst jobs. The first one was pharmacy technician. And the reasoning behind it was there is no growth in it. You don't really go nowhere. And if you do go somewhere, it's because you had to fight for it. Like you had to fight for it. So I realized that, and I spoke about this with you probably 2 years ago. Um, there is no growth. Like after a while, after I do something like, oh, she's good at what she does. She's a good teacher. She packs her meds good. She barely have mistakes. And then I just sit and I'm thinking like, what? What am I getting out of this? The paycheck? That's it. I don't get no trophy. It's not like, oh, Miss Everett is the director or she's the vice president. That stuff is like grandfathered in, right? So whoever's there is there, right? They're not really going nowhere. Only people that are going anywhere is pharmacy technicians, and the pharmacy technicians are going to other pharmacies to be another pharmacy technician. There's no growth. There is no ladder. You're not going up anywhere in that field. And that's why, like I said on the last question, people are in it because of life, money. I got to pay bills. I got to come here and back. If I knew that before, I would have did something else. I would have went to school for something else because you don't have to go to school to be a pharmacy technician. Only thing that a school does for you is probably educate you more on how to handle meds, wear your gloves, making sure the pill is exactly what it says as a description when you're packing it. But that's it. You don't have to go to school to be a pharmacy technician. You go work at a call center, you go work at a regular pharmacy, and they make you take a test, and boom, there you go. What we do this year, we have to recertify. That's it. And you're just paying for it. You
Hmm.
take the test, you got the answers, you probably gonna take it again, pass it, and you get your credits. It's not, if I had a child right now, I would tell my child, don't, that's not the field. That's just not the field. Like if I knew, I would have never ever continued this. I would have left after a year. I would have left. Is no growth in it. Like, even if you work at a hospital, I always tell people, they're like, oh, I want to work at a hospital. I say, yeah, but when you go to a hospital, it's very um strict. You can't call out because they probably only got two pharmacy technicians or three. So you can't call out. You probably gonna get fired. It's like a post office job. You're gonna get fired because it's a hospital. So we're talking about patients are in there all day. They need medication. So it's not something that you can play with as far as a hospital. But if you work in a closed door pharmacy, it's like a call center. The turnover rate is quick. You're here today, you're gone tomorrow. There's no union behind it. There's nobody fighting behind you unless you have a good supervisor and they give you a chance like, hey, you've been going through this. But if I can go back, I would have never been here this long. Ever.
Yeah. I totally agree with you on that, hands down. I mean, it is. Where are you going after that? You
No.
know, when you get to that certain spot, where are you going? I think also for me, also when I think more about it, is how much of time I'm going to waste on it.
Mm-hmm.
A lot of people don't think about that. You go to school for it, like you said, you go to school, you get your license, you done, and you just work, work, work. That's it, pretty much. What am I benefiting off of? I'm not getting nothing in return. Like you said, you have to be grandfather in to get that promotion. If you didn't, you're not doing nothing. You're not getting nothing from it. You might get a raise like a 50 to a dollar
It's
raise sometime.
a 50 cent. It's 50,
50 cents. Yeah,
you don't even get $1 unless you
right.
just somebody really, really like you. They gotta really like you. You gotta go over and beyond. They gotta
There you
really
go.
like you. So, you know, it's not I'm not telling you I'm so happy that we are having this topic because that's all I've been thinking about within the last 2 weeks because I've been like, this is too I was just telling Gigi about this. This is just robotic. I cannot pack. Johnny, I can close my eyes and I can tell you how to pack anything in that pharmacy right now. It is robotic. It's not
Yep.
fun. It's not exciting. It's not like, woo, we saved a life. Woo! Yes. No, it's not. It's not. And I be thinking like, who came up with this? Where did this come from? Like, like, and I appreciate my job. I thank God every day because people are going through worse situations. Um, Somebody just told me that the company that I work for is at its highest paying right now. So I feel like a prisoner to money. Man, you talked about this the other day. I'm a prisoner to money right now because I can't go nowhere else because they're not giving me the same money. They're not. They're
Yep.
not. Giving
That's
me the
it.
same. So I'm a prisoner to money right now. This is robotic and boring. Um, Even if I go to another department, it's gonna still be robotic. If I'm answering calls, if I'm putting in scripts, it's robotic. But like I said, and I don't want nobody to say that I'm downplaying the pharmacy technician field. I'm not. I'm not. It may be people. I've never asked people because, again, it's a fast paced job. You're working. Sometimes you don't want to talk because you're trying to stay focused. You don't want to get distracted. Some people may do like what they're doing, but nobody can actually explain to you why they like it. They can't tell you. It's not like I'm a police officer. And I'm not going to say too much about that because I know you have more questions regarding other fields. It's not exciting. It's not like I'm a nurse and I'm putting an IV in them. They're in pain. I'm giving them morphine. Like you're helping somebody. You don't know what you're doing. You're just giving them a medication. It's not the best field to be in. If I had to give a speech, that would be my speech. It's not the best thing. If you're saying that, oh, I don't want to be bothered with customers, it's a good field. Long-term care is a good field. You don't got to talk to patient. It's closed door, right? Um, if I'm not in the mood today, I can come in and work and be quiet. It depends on who you are. But for me, it don't work for me. Like for other people, it works for them. Like they don't mind coming in and packing meds. They don't mind coming in and being quiet today. They don't, people be going through their own personal problems. And I do appreciate the job because of that too, because sometimes I don't want to be bothered and you are a witness of this. And
A lot.
I'm in a quiet mode and I ain't gotta talk to y'all today. Good morning, good night. You got this drug, you need some extra pills, that's it. Like, but some people, I don't ever want to discourage people about pharmacy technician because I don't want to make it seem like it's so bad. But for me coming into that field and I've never wanted to come in that field, it's not something that I want to do forever. It's not.
No.
So if I can go back and I can see other people doing it and I would ask questions about it, it probably would never be my first option.
Yeah, I'm with you on that because, like I said, you can put so much of time into this stuff, but at the end of the day, you're just wasting. You're just wasting. Waste of knowledge, pretty much.
Yeah.
Waste.
Unless you're If you're content,
That's on you.
hey,
Hey, yeah, nigga.
I'm happy with you. Being content is okay because
Yeah.
this is what you come to me and say, hey, this is what I want to do. I like this. This is cool with me. I respect that. But if you're an outgoing person, it's probably not going to be for you. It's not. I'm not gonna lie, if they could send me to different pharmacies and teach people and train people on how to pack stuff, that would be exciting. I'm gonna make sure I jot that down to let my bosses know. Like, start sending me somewhere.
Mm-hmm.
Put me on a flight to this pharmacy in this state. I would love it because I'm teaching people. You got to figure out what it is that you want to do. I like teaching people. I like educating people because I like to be educated too. So that's probably where I need to stir off into. But just sitting in the pharmacy packing meds, it is not for me no more.
Yeah, no, it's not. And I think for me, you already see me. I venture off pretty much halfway. I'm 1 foot in and 1 foot out. Pretty much for me, I'm basically halfway out of pharmacy right now.
Is there something else that's more exciting for you?
Yeah, and that's the crazy thing. I got a lot of different stuff that I do, so I'm having more fun on the outside versus being in the inside into the pharmacy world.
Right.
And so I think, like you said, man, pharmacy though, honestly, it's like a waste of time. I mean, at
Right.
most you can put about 3 or 4 years into it, maybe even 5. But anything after that is dead. You're not going
Yeah.
nowhere. You're not unless you having fun by doing IVs, maybe different story. Or
Yeah.
working inside
That
of
would
a clinic pharmacy. Or me, like personally for me, I had more fun as a pharmacy tech when I was a compounding technician. I compounded so many different drugs from troches to RDS to capsule making tablets. It was so much fun. I had so
that's
much fun every freaking day, waking up,
yeah.
going there. It was fun because you don't know what
No,
you're gonna
about to
do.
go about to bake a cake.
There you
And
go. Yep. We big. Hey, I'm Chef Boy J right here. I'm gonna cook up something today. I had
that
freaking
actually
fun.
is fun.
Yes.
That is like a meditation.
Yes.
It's meditating and it gives you a clear mindset. Like, so yeah, a lot of people no, they don't know, but I respect anybody, like I said, because I don't want y'all to get on here and be like, oh my God, she said this. I respect anybody that gets up and go to work. I don't care what job you have. I respect it because we're living in an economy that, an excuse is zero. They don't care about that. So you getting up and you're doing what you have to do is very respectful. I applaud that. It's just if you're a person that's thinking about your future, those are things you want to think about. You want to think about, is this something that I like? Is this something that I actually enjoy? Like, that is the main topic. Do you enjoy this? Does this does this like my mom is a police officer, and when she worked on the road, her main goal was like, I want to help other people, and she worked in the same city that she was born and raised in, and she's seen people throw their lives away, gang violence or drugs, and we've had family members on drugs and stuff like that. So my mom wanted to give back, and it was an excitement for her, or bad mothers or bad fathers, and you being brought up in a bad family in a household and stuff like that. So that stuff was exciting to her, but at some point she moved up and she moved to a specials unit that she teach people how to deal with, oh, we got to gas this person today. Like, my mom does gas massing. Like, when they have a new squad that comes in, they have to go through a training where they put them in a gas chamber. So when you gas somebody, I need you to be able to maneuver through this gas. That is exciting to her. You know what I'm saying? Or when we have big concerts and we're sitting in our big police unit and we have cameras that are everywhere that people can't see, I'm here to make sure you're safe. You know what I'm saying? So that stuff is exciting. So you always want to find things that excite you. You want to find things that you want to help others at because you've seen this person fall from it. So I want to teach the next person how to uplift from that type of stuff. I want to show people how to move through things like that. So that type of stuff is exciting. So I'm not knocking pharmacy technician. I'm speaking about my personal experience, and I don't want anybody to bash me about it. But you want to do what is good for you. You are your priority. God and you are your priority. If it ain't working for you, you keep it moving.
That's it. That's it. That's the only thing, pretty much. Um, we do have another question.
Hmm.
Man, I think we pretty much went into this, but what is the common myth about your job or the industry that you work in?
That is hard. So when people come in, and when I came in, I thought it was gonna be hard. Remember my first week? I told you I wasn't coming back. I think I had told you that I wasn't coming back. I was like,
They told me that twice.
yeah, twice. Right. So look, y'all, this is so funny, right? Because sometimes I have a great memory and sometimes I don't. I came from a facility where you didn't have to dress professional because when I worked at Walgreens, it was a closed door pharmacy as well. I wore jeans and my little Tory Burch flats and my dress tops, or sometimes, I wear sneakers. So, but I'm not standing. I was sitting majority of the time. So my feet don't hurt. When I got to this pharmacy, when I walked in the pharmacy, I said, first of all, the distance was just outrageous because I stayed in Pembroke Pines. This pharmacy was in Fort Lauderdale off Commercial, right? In between Commercial and Cypress. So we're talking about 30-40 minute drive, right? Because traffic. I said the drive is crazy, but I need a job, right? So I'm going to drive because I got a car. That's what you do with a car, you drive. I was standing up for 2 days. Baby, I was walking on the back of my shoes for 2 days. I literally took them Tory Burch flats. So I still got them. Super cute. Standing on the back of them because my feet was hurting so bad because I was not immune to standing. I knew I wasn't going to make it because every job I had before this was a sitting down job staring at a computer. I said, "Oh my God, I'm not going to do it." Packing the medication like the Eliquis for sure. Eliquis and half tablets, metoprolol, or however you say it. I might be saying it wrong. And Johnny is, I always tell people this story. I packed that metoprolol wrong at least 3 times. And he made me do it over and over until I understood what I was doing. And I said, "I'm not coming back tomorrow." I said, "I'm not coming back." He was like, "Yes, you is." I said, "I'm not coming back tomorrow." I said, "I can't do this. This is too much." I said, "The pharmacy is too big, first of all. You have this, you have topicals." I wasn't used to that. So I was just like, really like, I can't even think of the word, but I was just like, my spirit was down bad. I was like, I can't work here. It's not for me. I didn't think I would even last a month. I was like, no, I can't do this. Like, I'm already driving here for 30-40 minutes. My feet hurting. When I tell you my feet was hurting so bad that me wearing flats had one of my toenails like so close to my other toe, it was cutting. This is TMI. It's too much information, but my toenail from my foot was cutting another toenail because it was so close because it was compressed. It was compressed. If y'all hear noise in the background, it's my siblings. It was compressed and I was bleeding. I had to put a band-aid on to wear flats. And that's what made me buy a pair of Crocs. And I hated Crocs. I was like, I'm never buying Crocs. They are so ugly. Like, I don't like Crocs, but I made it through. I'm not gonna lie. Johnny was like my biggest he inspired me like, yes, you can, you could do it. You is coming back. Yeah, you is. I was telling him one day when I was leaving, I said, I ain't coming back tomorrow. I said, this is too much for me. Like, imagine packing something with foil and you're doing it wrong and you have to print the foil over for those that are in pharmacy. If you're packing something with foil and you pack it wrong, you have to print the foil over. You have to print the label over. You have to print the little sticker that gives you details on what the drug is over. I was done. I was done. I was like, I can't do this. I can't do this no more. Like, but I made it through because I remembered that again, Experience is the best teacher. When you continue to do something over and over, you learn. You learn from it. Like, it's not the end of the world. You're you're not gonna die. You're gonna do it over until you learn.
Yep, that's true. Y'all, first couple of weeks with her, it was hell, but it was fun at the same time. It was the best thing. Um, but hey, look at you now.
And you would stand right there and let me pack it wrong.
Yes.
And listen, you're the reason that I do this to my trainees. Today, there's a Jamaican lady. She's older than me. And I was showing her how to pack the famotidine, like as a kids corner. So now, kids corner, they print them by themselves because they had so many complaints with kids corner. And I love the kids, you guys. Like, it took me a while to understand it because at first I was just like, oh my god, I don't like doing kids corner. I have to give them a syringe, I have to give them a cap. But I learned that they are sick. They cannot orally take things. Everything that they're taking is through a G tube, right? Which is, it sucks. God, thank you so much. Like, I just have to put that out there because you don't understand what other people are going through, and people are born with these medical issues. And I was like so aggravated when I got a kids corner. So now when I have kids corner, I make sure I get them their syringe, they cap. I'm gonna give them everything they need because they're babies. Some of them are babies, newborns, 3 months, 4 months. Like, so I'm solely like into that now. And I told the lady, I said, listen, this is what I do. When I'm training people, I'm not training to tell you everything, because when you're telling people everything, they just go off what you're telling them. If I leave tomorrow, who's going to tell you? Nobody's going to be able to tell you because you've been so listening to me and you're not educating yourself. Education is very important. Always educate yourself. I want to throw that out there. I said, you're going to read the bottle and it's going to tell you how many days they have to use this medication after you've poured water in it. So the lady kept telling me, it don't tell you how many days. It don't tell you how many days. I said, she passed me the bottle. Mind you, I'm your trainer. I know what I'm talking about. You may not know what's going on, but I know what I'm talking about. I passed her the bottle right back, Johnny. Even though I know how many days they have to use it. I gave it back to her. I said, it's on there. And she looked at me and she laughed. She said, you really gonna do that? I said, read it. I need you to read it. She go, I can't see it. I can't see it. I said, read it. And then she started agitating me a little bit. So I took it from her. I said, look, it says after reconstitution, you have 30 days to use this medication. She was laughing so hard. She was like, oh my God, I understand why. I said, yeah, I'm not here to give you all the answers. You are a pharmacy technician, and that's the problem in pharmacy technician field because it's so easy to get this certification that you're not educated. And I'm a witness of it. Listen, I'm a victim. It's a lot of stuff I didn't know, but I got my certification, right? I said, listen, this is how you do this. It says 30 days. It tells you how much water you're supposed to put in it. It tells you that it need to be shake well. I say it's of a I might be saying it wrong. Isothermycin, whatever. I think that's the way you say it, but I heard somebody say it different. Some of that stuff goes in the refrigerator after you put water in it. I say you have to read the bottle. You have to educate yourself for you to understand. I can't always give you the answers. Like when I say hilarious, Johnny, she was laughing so hard at me. And at first I was like, oh, she's going to be mad and she's going to complain and say, I don't like the trainer. She's mean. But my mom taught me that. She was like, when you're training people, you have to teach them the hard way because you are a technician and you should know how to do certain stuff. Even if you went to Walgreens like me, at some point you got to be like, okay, I need to learn how to do this. How you do this? They asked me, oh, this says 3 ml for the pen. Read the box, babe. How much each pen is? It's 5 with an X multiplication, 3 ml pills. So what, 15, right? So it's a total of 15 in one box, right?
Mhm.
I need you to educate yourself. I need you to understand what you're doing because I'm not going to always be here. I can't give you the formula all the time. You got to know what you're doing because your license is on the line. not mine. When you pack it under your name, your license is on the line, not mine. It's true. So I get that from you when you sat there and made me do it over and over. And I'm looking at you like, I'm like, why is he letting me still do this?
Yeah. Hey, man.
I'm packing 15 half tabs instead of 30 half tabs.
Mm-hmm.
15 times 2, 30 pills, but they cut in half.
That's it.
And he made me pack them. Y'all, he made me pack them 2 different times instead of telling me.
Hey, man. Hey, I read it for you. I can't, like you said, I can't give you the answers every time. Some common sense it should be common, but common sense is not. But I read it for you to
And that's
make
not common sense.
mistakes. I read it for
Take
you.
that.
Yeah, I know.
Take it back. It's not common sense.
It's not.
It's because how easy it is to get in pharmacy field. It's not it's not the same like you went to school to be a doctor. It's you worked at Walgreens. I'm a victim. I worked at Walgreens. I don't know what 15. Oh, take a half a pill twice a day. It's gonna say 30, right? It's gonna say 30, right? But you're cutting 2 sets of 15 pills in half. So you're gonna have 15 half tabs, which is 30, and then you're gonna have another 15 half tab, which is 30, right? So it don't make sense, but because the field is so easy to get in, that's where it dumbs it down. You don't know. You're not understanding. Because you didn't go through something that broke it down. Like you was in class and it was like, okay, 15 half tabs at times 2, 30. They don't teach you that when you go to a call center or you're at CVS, unless a pharmacist tell you like, okay, this is how it's supposed to be done. But a lot of people don't know. I didn't know that. I didn't. It was confusing. I was confused for a long time. And then I had to understand it like, okay, they're taking it twice a day. So that's why they saying it's 30 pills, because if you cut 30 pills in half, it would be 30 on this one and it'll be 30 on that one because they're half. So it's half of that. So yeah, like I appreciate it though. I really appreciate what you took me through.
Oh yeah. All right. I'm gonna take you to hell. And I think out of everybody, I push you the hardest because like I told you before, man, I see a lot of potential in you. That was like the only reason why I did it because I saw the potential and I saw you pretty much how I started off, like coming in like hot headed, think we know everything. At the end of the
Yeah.
day, we okay, hell, we got our ass beat down on the first week. Second week,
And you
got
wanna
beat
know what's
down.
funny? I always tell people this, like, me as a trainer, I don't I don't ever want to be in control of what you're doing. I don't ever want to hide anything from you. There's people that I work with and they will give you the answers because when they're not there, you're lost. I want you to be like, L taught me this and this is right. That's what I want. I don't never want to hide anything from nobody. I don't want to give nobody nothing. I want you to know how to do the same thing as me. It's like, not to throw it out there, I'm not a hater. I want you to grow because let me tell you something. When I want to leave, I want them to say the person she trained them exactly how she worked. So they don't have to hold on to me because you could do the same thing I could do. That is my biggest thing right now, Johnny. When I tell you my biggest, I be like, oh, come here. Let me show you how to change the paper. Come here. Let me show you how to do this. Oh, this is where the bottle's at. This is where the syringe is at. This is where the bingo card's at. This is where the blister's at. I'm not hiding nothing from nobody, Johnny, because you don't get your blessings like that when you hide stuff. You know that the 50 laws of power, like I was trying to really get into that. And it's a lot of stuff I didn't like because it's something in there that says that you never give nobody the game. You get them a piece of it, but you never give them the game. I don't like that. I don't like that in my field because that's why when I tried to leave, they didn't want me to leave because I have too much knowledge. I need all y'all to have this knowledge because I can't be here when I'm 50 years old. I need you to step up when I leave.
Of course.
I need you to step up. I said that to one of the girls, big girl.
Mm.
And she took it back and said something to somebody. This is not too explicit for your podcast, right? I can say what I want to say, right?
No, you can say what you said.
Okay. So one of the girls that I was training, not training, because she kind of came in when I was on vacation. a few years ago, and I wasn't there, so I didn't really get to train her 100%. But I mentioned something to her because me and her was close, and I said, "When I leave, you can take my spot. I'm teaching you something that if I leave, you can take my spot." And she took offense of it as if I was downplaying her. Her mind wasn't where it should have been because you were supposed to be like, okay, Johnny, I always ask you, how you do this? How you do that? What's this? What's pace? For for months, I didn't understand what pace was. I didn't understand what that was. I didn't understand why we're putting timestamps. I didn't understand why so much going out. I wanted to educate myself. You never told me, oh, I'm not telling you this. You know what I'm saying? Like, so it bothered me when somebody came to me and was like, oh, she said that she didn't like how you said you could take a spot. Yes. Why would I not want you to? Why would I not want you to? Why would I not want you to? You think I want them to call L every 10 seconds? Oh, how do you, I need you to do this. I need you to do that because this person don't know how to do it. No, I'm not that person. I'm the person that wants you to do the same thing. If I broke a leg tomorrow, who is going to do this? I need y'all all to be on the same page. I want us all to know. I have never been a hater and I've never held people back from learning. I need you to know how to do everything. I don't want you to ever come to me and ask me anything after I've taught you everything. You can ask me, but black people, I want all us to be educated. I want all us to get money. I want all us to be on top. Think I would hide that from you? Think I'm gonna just shortcome you and say, "Oh, I do it." Oh, you don't know what this? I go get it. You will never know.
Yeah, but that's one of the biggest conception of us black people. We are envy and jealous of each other, even though we say that we cool, but we not because
I've never been envious. When I tell
yeah,
you, Johnny, I got an envious bone in my body. When I have to do compounds because nobody else knows how to do them, that make me mad. I want you to do these compounds too, babe. I want less stress off of me. You think I want to be the only one that's doing
no, you're
this?
right. Hey,
I may make more money than you, but I need you to learn how to do this too. Simple.
no, you're right.
In the work field, period, like not work field, but medical field, some people tend to they keep stuff from you. They don't want you to rise above them.
Mhm.
And sometimes people do need to rise above you because you may not want to be the leader, right? I don't want to be a leader. I don't want to be a lead. I don't want to be a supervisor. I want my supervisor to be amazing. I want my lead to be amazing. I want to just be the girl that come to work and make money. That's who I want to be. I don't want to be the girl that y'all call on every 10 seconds. Mm-mm. No.
Hey, but that's how things are, man. We just have to go along and do what we can do.
Yeah. I guess I'm a good leader, but we can go on to the next question.
So, okay, and if that's the sense of from what you said about the knowledge within the pharmacy, do you feel the field evolved within the last couple of years or not?
Yeah, I've been like you're saying, if I've been very involved in the pharmacy field where I work at.
No, like more so of like the knowledge within the pharmacy.
Yeah. Yeah, I've learned a lot. I still am learning. Like today I learned the flu vaccine. So like the flu vaccines come around the same time of year. They be having like today I packed 64. I packed 12 regular flu vaccines, and then I packed 52, 65 and older vaccines. We have the orange and white box and the blue and white, which is 65 and older. And I was like, so y'all didn't take the flu vaccine last year? I was being funny. I was like, why the heck is there so many of these? So you didn't take them last year? Because I thought when you take a vaccination, that's it. You don't need it no more, right? And somebody was like, no, every year you can take it. And I was like, oh, because I was just looking at the labels like, why the hell are they taking this again? So, knowledge wise, yeah, I learn stuff every week. I'm not gonna say every day. Every week I learn something new. Like I'm not gonna lie, but that's just with anything. That's how I feel. Like it doesn't matter if it's pharmacy field or whatever, but in the pharmacy field you do learn stuff because one week you might just pack the same thing every day, the same drugs every day. And I had a girl tell me that at night they pack different drugs than what we pack. Like she asked me about a benefiber powder. You know the benefiber powder in the green box.
Hmm.
And, and I ain't never packed this before. What this is, and I said it's right there in a liquid house. B, their packets. You put it in the water, you shake it up, you drink it. She was like, that's crazy because at night, because she had came in the morning one day to make up hours, and she said, at night, I've never packed this. So, you learn different stuff all the time. You learn a lot of different stuff. Like, it's a learning experience. Like, I'm not gonna say I'm perfect at it, but I do learn different stuff every few weeks. It's something new. I'd be like, oh, okay. Like we had a pharmacist that told me compounding, it's a if you mix an ointment with another ointment or whatever, or ointment with a cream, instead of it being 30 days, it's supposed to be like 90 days. Like Sudine, I don't know if you know her, but she's a pharmacist. But I guess she traveled a lot. But now she's been coming in on the weekends, so I had did a compound, and I put the expiration date for 30 days, and she was like, "Oh no, this is supposed to be 90 days. Some of them are 180 days. It's because it has an ointment." And I'm looking at her like, "I didn't know that. I just go and put 30 days. That's it." Like, so yeah, you do learn stuff. You are educated on different stuff every day. Again, you're not a pharmacist, so you didn't study medication, you didn't study drug interactions, and if this is mixed with this, you can't use it after this time. It is stuff that you learn all the time. Can you take it anywhere? Not really. It's just a memory. That's it.
Of course. And to your question, yes, I do know her. She was one of my mentors coming into the pharmacy. Uh, that's my buddy right there. That's my number one pharmacist right there.
He's so nice. He's like, before I was like, oh my God, she's coming in to watch us. Like, on the weekends, we put in our AirPods. And everybody be doing their work. And then one day, so she's in charge of like
Hmm.
compliance, right?
Yep.
Because I'm the trainer, she's been talking more to me, like, you know, how is this packed? How is that packed? And she told me that day, oh, I'm going to talk to the owners. We're not going to say names. I'm going to talk to the owners, and we're trying to get every pharmacy on one accord. And I said, oh, yeah, I've been told the last supervisor this, that, our SOP and our training packet is not accurate. Like, it's a lot of stuff that I have to go on. I'll print out the packet, and then I have to go and edit it. Like I have to exit this and put this goes in this bag, or this doesn't. So it is something that's been around before I ever even got into pharmacy. So, she's been communicating with me about that. So, she's super cool. Like she's just trying to make sure this pharmacy in Fort Lauderdale is doing the same thing as this pharmacy in California or this pharmacy in Tampa. And I said, yeah, I've been saying this, but sometimes when people like me speak up, it sounds like I'm just complaining, but it's a fact. We should all be packing things the same way.
Of course. Always. It should always be like that. But also we got to take into consideration is different laws in each state.
Mm-hmm.
Um, like in North Carolina, they can have gabapentin. Gabapentin is a control versus down here in Florida, it's not. So it's pretty different.
You want to know why?
Huh?
Sorry to You want to know why too? So my brother was on a gabapentin, and so is my friend, and they both had pneumonia. Gabapentin makes you drowsy and high. Took it, and he was just like, "Oh, the metformin, maybe not the gabapentin, the metformin." And he was like, "I'm so tired," like, and I was like, "Well," he's like, "I took the metformin," and I was like, "Oh, okay, whatever," because again, I'm not educated on what it does. I don't know the side effects. And then, my friend, she was taking it, and she was like, it's making me so high, like, so that's probably why in different states it is, a certain way, because we have like people coming from California, because now they're transitioning over to framework. They're not using framework right now, but now they're using framework now. And in California, they don't use X stamps. They write on the back of the bingo card. They don't write. They don't use the exams. They have to actually physically write. And I was like, oh my God, you have to do all that? And she's like, yeah. I'm like, oh. So we're trying to get everybody on, one, which is good because what if somebody wanted to transfer?
Of course. Well,
Now I got to
hopefully.
change everything. I get the laws, but okay, a sticker, yeah, high alert. Okay, cool. But you're packing this totally different than how we pack it.
Yep. Totally different. But I think, but as far for the question wise, I think also, the problem I think with the pharmacy world right now, I think is pretty much lazy. Give too much of answers away instead of you training and you learn and pick it up on the knowledge of everything. So that's one of another the reason why the pharmacy world sucks. I ain't gonna lie to you, it just sucks, big time. But for the next question, if you can swap careers with someone for a day, who would it be and why?
I don't have a particular person, but in a actual department wise, well, field wise, it would be like a private investigator. Like I think that I would be great at like investigating stuff. You know me, I get down to the nitty gritty, like times, dates, movements, body language. Like I would love to do something like that. Like I think that is like if I ever had got in the law field, I would move up to like a private investigator, CSI, or like sexual predators, stuff like that. Like stuff like that, I would like to get into. I would always like to stop crime. When it comes to babies, I love babies. I love kids, like sexual predators and stuff like that. Like I'm like really soft hearted and I don't like stuff like that. So I would love to I would swap just to be in it, just to do that, just to stop people from harming other people, especially minors.
Hmm. Okay. I think for well, shit. You want to be a private investigator? What the hell you going through? Uh, I think I think for me, I think I probably would have to say I would swap careers. Probably to just be a president for a day. That
Oh no,
Yeah,
Johnny.
yeah, damn
Oh
right. I'm
no.
finna be an asshole. I'm gonna be a petty president.
Oh, you giving Trump?
Yeah, I'm gonna be
Uh,
a pet. I'm gonna be petty. I'm gonna be damn petty. I have to be a president. Like people that age 65 and older, you can't not be on the road driving. You need to have somebody in the road.
oh no, that's not fair.
No,
That's
I'm
not fair.
taking away. God
Who
damn.
who just turned 73 and he drives? Okay, I had just told my mom this the other day. I was like, these people are really because I had watched the debate with Kamala and Trump, and I was laughing the whole time because that is it's a comedy at this point. I was like, who would be fighting to run the country? Because I would never want to run the country. Do you think I want the country to be in my hands? Never. Are you crazy? Never. I am too stern to run the country. It would never work out for me. Ever.
I want the damn country. Oh, you talking shit? I'm gonna press the button and fuck you up. Yup, you dead. Damn right. I'm
See,
gonna be
that's
petty.
that's exactly why you ain't.
I'm gonna be petty. I just want to be petty. I'm already petty, but I'm gonna be even more petty as a damn president. But no, I get what you're saying. Yeah, you don't want the whole world, well, the United States in your hand. Let's put it that way. But it's just pretty much to just make laws, change a lot of stuff that need to be changed. That what we deal
What
with on a
What
daily.
is one law on the top of your head that you would like to change?
What is the one law? Uh,
Mm, since you want to be Mr. President,
gun rights. We got to change it. You know,
like,
you got to change it. Like for example, the kid up there in Georgia, it's just like, come on, man, 14-year-old, what he doing with an AK? He doing with an assault rifle? Like what? For what? You buy him that's a Christmas gift? Like, come on.
all right. So was he an African American or was he, you know?
He was Caucasian. He was Caucasian,
Okay.
but that's for
So
anybody.
I
That's
mean,
for anybody though.
I'm gonna make
So,
it a
but let me
stricted
piggyback.
law on it. Like,
Let me piggyback, right?
okay, go ahead.
So I seen something some years ago how those people, I got nothing against those people, but I don't want to say, they teach their kids at a younger age how to use guns in the sense of violence or life threatening situation, right? And I think that is kind of important because a lot of us in our community, our kids normally either shoot themselves or shoot someone else because they're not even taught how to use a gun. So there is this guy, this black guy on the internet. He has like all these tattoos everywhere. His girlfriend has tattoos everywhere, and he teaches his kids how to use guns, not to kill anybody on a normal day basis, but just, if something happened and mommy and daddy is in a situation and you know where the gun is and you can help us. I kind of agree with that because I would rather my child know how to use something versus not knowing how to use something and kill themselves or kill someone else. Um, I definitely agree with that. Now, of course, I don't agree with some people are just mentally, you got to remember that some people are brought up in a different mental state than us. So they use guns in different ways. They use guns because of racism. They use guns because they're schizo or, things like that. But I did see the other day, it has nothing to do with guns, how this 12-year-old girl, yesterday I watched it on TikTok, this 12-year-old girl, um, suffocated her 8-year-old cousin because they were fighting over an iPhone. They were in a room, they had bunk beds, and I guess the 8-year-old wanted to use the phone, but it's technically the 12-year-old's phone. She suffocated this 8-year-old girl, repositioned her, Johnny, put the covers on her as if she was sleeping, and the next day, when the grandma came in, because they're cousins, so grandma must be watching them. Grandma comes in, little girl is dead. She goes to look at the cameras because she has like a camera in their room that they sleep in, and she sees the 12-year-old girl tampering evidence, because by law, it's tampering evidence, put her up and put the covers over her. She watched her kill her, right? That's the first point. Second point, you notice that she's dead. You put covers on her, position her to lay down as if she's sleeping. A 12-year-old little girl is probably going to be sentenced to 25 years to life. She's going to turn 13 in a few weeks. So she's going to be charged as what? An adult. As an adult. So for me, when it comes to kids, I just feel like everything is just moving too fast, right? Because because one point, you shouldn't even be on your phone at night. You're 12-year-old. Let me get your phone. I'll put it on the charger. And in the morning when you go to school, at this point, I don't even want my child with a phone at 12. I don't care how advanced things are, but just the simple, small things like that bothers me. And my mom was like, "Oh, what do you want? Because I was like, they're really going to send her to jail?" And she's like, "Yes, Lanisha, because she killed somebody. She know that she killed somebody. It's not that they were fighting and she killed her. No, she suffocated her." And I was like, it's technology and things that kids care about. And she probably was on TikTok or, and it like really bothered me. And I was like, I'm so precautious of having a kid right now. Cause guys, yes, I don't have a kid yet. I'm so precautious of having a kid because I don't want to be overly strict, but I would never want something like that to happen. I don't ever want my child to be fighting another child or kill another child over a phone because they're so addicted to their phones. It's bad. It's bad. Like, and it really bothered me the other day because you're 12 years old, you're going to be 13, you're going to go to prison for 20 plus years. You're going to get out and you have no idea what the world is. You didn't experience life as a young woman. You didn't have a first boyfriend. You didn't, do adult things with a guy. Like your whole life is just, that's it.
Yeah, I understand what you're saying, but at the same time, though, you also got to think about it. Start from at home.
It does.
You know,
It does. I said that because I said at that point she should never been using her phone at that time of night. Anyways, it's sleep time.
Yeah, it's sleep time,
Going
of
to sleep.
course. But also though, it's not also about the phone though. It's also what is she seeing from her mom or dad, or what are she hearing from her
Or the internet.
friends? Everything. You see what I'm saying? You got to put all that in cahoots with it, put that all in a bundle, and you think about it. Okay, it's this, it's A, it's B, it's C. It's so many different things that what kids deal with on the daily versus how we deal with stuff as a when we were kids. We used to say, okay, we finna fight. We just gonna
Or we
fist fight.
going
We
outside
going
and we're gonna go
outside.
play
Yes.
outside.
Nowadays, it's you gotta think about a lot of these kids, and you know what? And another thing, let me say that. And think about in a black household, a lot of the kids they did not deal with ADHD or any type of problems like that. Why? Because our grandparents they would smack the shit out of us, and it would take it
What?
away. It would take it away. That kid, he ain't stupid. He know what he doing. I deal with him. You see what I'm saying? So a lot of the kids nowadays don't have that, and if they do, they're about our age. 33, 34, 35. They young grandmas. Like, come on. What are you
Yeah.
know? So
Oh.
yes, I understand your point. I do feel bad for her, but at the same time, she had that knowledge. She knew what she was doing.
Mm-hmm.
She definitely you temperated with evidence, so you doing something. I
Purposely.
yes, on purposely. So yeah, I get your point, but I think mostly though it still had to come down to the parents, what they deal with on a daily, and just
Yeah.
overall of what they
Because
see.
me, you're going to sleep. Where's your phone? I got your charger.
Hmm.
When you wake up in the morning, you can use your phone. But at night, you're not using your phone. You're not using your phone. What you need to use your phone for at night? Who is you talking to?
Of course.
Your phone be sleep too. But yeah, like the gun thing, the gun law, like um I don't like guns. I'm gonna throw that out there. I don't like guns. I'm very scared of guns. I've been to the gun range 3 times and I freak out every time I go. I haven't been in like 5 years. I'm scared of them. They're too powerful. Um, I hate whoever made them, but then I'm happy that they made them because it's just like, I'm a female. If there's a 300 pound man trying to fight me and I got a gun, I can put him down at some point. So pros and cons to it, like they should. I seen something on TikTok where they was saying, gun laws is like up and down. Like people that have guns should be they shouldn't have like a record and they shouldn't do this. And I'm like, in my mind, I'm thinking like, yeah, but if they don't got a record, then they're gonna think they can get away with this. You know what I'm saying? So it's so hard to speak on because you may give a normal person a gun and somebody's bothering them and they feel like I have a gun and this is my defense mechanism. I can kill you. But what if that person shouldn't have been killed? You know what I'm saying? So it is a up and down thing. If I could have a conversation with Jesus Christ himself, listen, which I can, but if I can see him in person, take him away. And when people do bad stuff, take them too. I don't want to see people getting shot. Like it's bad. Like this girl that used to do my hair in high school. She just lost her son, her oldest son. She has 4 boys. Her oldest son, and your first child is like your best friend. Lost her son to gun violence, and they were like trying to shoot at his brother on his dad's side, and he died. He wasn't even 21. He was 20 years old to gun violence. Like, so yeah, I don't really like guns when they're used in the wrong way, but I would appreciate them if I'm defending myself.
That's why I say that's probably if I can become a president, that's will be my biggest challenge right there. Will be the gun law. How can we keep it so that it satisfies people, but also keep us protected and not knowing right from wrong? You see what I'm saying? So that's one of the
Mhm.
biggest thing. And also the next thing also will be our healthcare. Our healthcare. That's another issue with the insurance paying for what they want to pay for. A lot of celebrities
Mm-hmm.
getting a lot of too much of power on stuff.
Of
So
course.
so yeah, so
Yeah.
those would be the biggest challenge that I will face on a daily if I can become a president for one day. So, but
You're gonna need about a week, but okay.
yeah, hey, probably will. But hey, I'm gonna do something. I'm gonna try to make it something. If not, I'm gonna press the button.
Oh wow. Oh wow.
I'm just playing.
What in the world?
Just too damn petty. I'm too damn petty, man. But Miss L, is there anything else you want to say tonight before we go?
No. Well, yeah.
Yeah.
For the people, you just in life based on careers, um, just for younger people, because those that are older, we kind of like settle right now because again, we're just focused on paying bills and staying afloat. But for those that are younger, um, figure out what it is that you like, and whatever it is that you like, make sure you're getting some type of revenue from it. Make sure that you can look at it in the long run, that you're okay. Like, don't just do something because you feel like it's the best thing to do. Do it because that's something that you want to do. And if you do choose to do whatever it is that you want to do, always get something great out of it. Don't ever just settle for anything. Always go high, never stay low.
Well said. I like that. Yeah, that's the main thing for everybody. Whatever career, like she said, whatever career you're going into, stay focused, learn, get the knowledge, and whatever it goes, it goes. You know, we gotta be like Kurt Franklin, order my steps. Wherever my foot
Right.
go, we just go. But as long as that way we gain the knowledge. But for everybody for tonight, this is the end of our show. Career wise. Thank y'all again. Thanks, Miss L, for tuning
Thank
in,
you.
coming
You're
in.
welcome.
Thank y'all. Peace out. Oh, look, y'all. Hold up. Breaking news. P. Diddy just got arrested. Oh, shit.
Oh
Uh-oh.
God.
This is something that I have to read
Oh.
about. I need to go find out why.
N-
But
Next topic.
anyways, yeah, hey, yeah, there you go. Next topic, y'all. Who knows? We might be back tomorrow. We never know. But anyways, y'all, thank y'all. Take y'all. Peace out. Love y'all. One love, y'all.